Intergovernmental, got it, panel on climate change, which uses modeling to help us understand what our world may look like under different scenarios. So there are representative concentration pathways, these are RCP, of carbon dioxide that show the warming of our Earth under different scenarios. And that's relative to a baseline average from about 1986 to 2005, and that's gray here. So relative to that average, you have these different scenarios. So RCP 8.5 in red is often called the business as usual scenario. And what that means is there's no reduction in greenhouse gases. We continue to burn fossil fuels at our current rate, and they just predict what will happen on a temperature scale. And you can see that by 2100, we have our Earth warming substantially with a temperature increase of about 4.5 degrees Celsius, which is about 9 degrees Fahrenheit. So that scenario is often contrasted with an aggressive scenario of cooperation and reduction, and that's RCP 2.6 in blue here. And what you can see is that by 2100, you actually still have a relative increase of about 2 degrees centigrade. And basically what all of these models demonstrate is that temperatures will actually continue to rise for several decades, according to any scenario. And that's because of something called thermal inertia, which just means that we're committed to further warming from greenhouse gases that were already emitted because they stick around and they take a long time to dissipate. So what that means for health is that the health effects of climate change will actually intensify for several decades, no matter what pathway we are on. What does that mean for Hawaii? In general, we know that air temperature has risen, rainfall and stream flow have decreased, but the intensity of rain has increased. Sea level and surface temperatures have increased, and the ocean is acidifying. And in the context of global health, what's our framework and how will this affect people? We are pretty aware that there are really large inequities in how climate change will affect the world. And this is a cyclone in Mozambique in 2019, Cyclone Idai. And the way that that cyclone devastated that country is going to be very different in a country with more resources. This is one framework that I like to use to think about the effects of climate change on different people. So there are climate drivers of health. We can take the example of increased air temperature. That causes an exposure pathway. So that would cause a heat wave. That then causes a health impact, let's say water and salt losses leading to dehydration, and that can cause a health outcome like acute renal failure. So at each juncture in the pathway, there are elements of vulnerability as represented by these gray arrows. So some people are more vulnerable to the climate driver. And so as we'll see, poor people live in hotter zip codes. Those that have underlying health disparities are more vulnerable to the exposure. So someone who has diabetes or CHF is more vulnerable in a heat wave compared to someone without. And then there is vulnerability in the adaptive capacity. So those poor patients who live in a hotter zip code, who are more likely to have diabetes, may be less able to access care, find air conditioning, and therefore are more likely to have severe health outcomes. So in general, what we see is that those that contribute the least to carbon emissions are likely to suffer the most. And we see this concept in One Health too, when we think about poor people living in areas with worse sanitation, and they may have more exposure to contaminated water and food, and thus have poorer outcomes. And we'll go through some of this later. So what can we do broadly to deal with our warming world? You have two things that we talk about, mitigation and adaptation. So mitigation reduces the emissions. So that's taking sustainable transportation using clean energy. Adaptation helps us to manage the risks from climate change that are already here. So having a disaster plan, protecting our homes. And then in the middle here, you have some of these overlapping strategies. So planting a tree in the middle of the city removes CO2, it mitigates CO2 from the atmosphere, but it actually also helps us to adapt to hotter weather with shade. And these things in the middle here, these overlapping actions create co-benefits for health. So trees provide space for physical activity and the psychological benefits of being in nature. So we see that climate change mitigation measures will take time to decrease greenhouse gases. And we already saw that we're committed to the CO2 and methane that is already in the atmosphere. But the health co-benefits of these mitigation measures are much more immediate. So converting from fossil fuels to renewable energy helps to reduce CO2 in the atmosphere, but the reduction in air pollution is actually much more immediate to our health. Using active transport, taking the bus, public transportation puts less fossil fuels in the atmosphere, of course, but it's healthier for everyone's lungs and bodies and minds almost immediately. So even if climate change were not occurring, all of these measures actually represent critical public health interventions in their own right. And that's why I think that thinking of climate change through a health lens is very, very powerful. So this is an overview from the CDC, adapted from the CDC and our friends at the Department of Public Health. And what you have here are all of these climate drivers. So these are things that change the climate: rising temperatures, increasing greenhouse gas, rising sea levels, and extreme weather. And they cause an effect on exposures. So air pollution, heat, drought, environmental degradation. And then these exposures themselves cause subsequent health outcomes: asthma, cardiovascular disease, malnutrition, etc. And we'll explore several of these exposures and health outcomes in depth, and the ones that are actually most relevant to Hawaii, and we'll tie this into One Health. And then just to show you that the mental health effects actually ring all of these different exposures. So stress, anxiety, depression, PTSD, we'll talk about this as well. So there's a lot of overlap in thinking about this from a One Health perspective as well. And so One Health, as you know, includes emerging, re-emerging, endemic, zoonotic disease, neglected tropical diseases, vector-borne diseases, microbial resistance, food safety, environmental contamination, and other health threats shared by people, animals, and the environment. And I really like this graphic from the Institute for Global Health. It just shows how all of those things, human, animal, environmental health, are interdependent. And our view today will be from the climate change perspective. And the health of people is actually closely connected to the health of animals and our shared environment. And further, we see that actually all of these mitigation strategies take care of the natural environment, which improves the animal environment, which improves the human environment, which we'll see. So I usually start with extreme heat in this presentation and go into depth because it's the one impact that is local and I think quite relevant. We always feel it. So I still think it's helpful to talk about heat first, and heat will impact many other portions of the wheel, which we can then link to One Health. So 2019 was the hottest year on record, and we are actually projected to get hotter. This is from NOAA for Hawaii specifically. And we see that same kind of graph. So compared to a 1951 to 1980 baseline average, we see that the temperatures in Honolulu have actually increased by 2.3 degrees Fahrenheit on average. The RCP 8.5 business as usual predicts higher temperature changes, and a more aggressive lower emission scenario, probably the RCP 2.6, predicts a lower band of increase. But as we discussed, we still see a temperature increase that is projected for us because of thermal inertia. And we feel that it's getting hotter, and we can see it. This is Wailea Avenue on a hot day. And it's actually worse in the city because of something called the urban heat island effect. So this is not climate change, but it is a man-made problem that exacerbates increases in temperature. So in rural areas, green trees absorb the water from the soil, and then they release that water from the leaves. And that's actually a cooling process. In the city, the concrete and the asphalt absorb and trap heat. We've all experienced this, and they release it throughout the day and night. And that's why it's hotter in the urban core. Heat from cars and traffic and exhausts makes this all worse. And the heat island effect intensifies during a heat wave. So according to community heat maps, the urban heat islands are located in red. You can see this is downtown, here across, and all the way over onto the west side. And then when we overlay that with the percent of persons living below poverty, we see that larger areas of poverty are actually in the urban core and the heat islands. And this is important for us as physicians to recognize, and again, is an example of the inequity in climate change effects. So when we talk about heat-related illness, we often refer to the heat index, which is heat and humidity. And when that goes up beyond 95 degrees, as temperature rises and the longer the heat wave goes on, you have increased mortality. Most of these fatalities are preventable, so early recognition is key. And just an example of this, in 2003, there was a massive heat wave in Europe, and France was hit the hardest. Temperatures were 104 degrees for 8 consecutive days. The summers in decades past have actually been quite mild. There's very little AC, and these elderly patients living by themselves really had never faced such extreme heat before. They did not know how to react, or they were too physically and mentally impaired by the heat itself to make the necessary adaptations. And France recorded an excess mortality of 14,800 deaths. And this is the study of that heat wave that looked at average daily temperatures from July to September in France. And what we see is we have an envelope of maximum and minimum temperatures overlaid with this daily excess mortality. And that was just calculated by taking the observed minus the expected number of deaths. And the expected number of deaths was just based on mortality data from 2 years prior. And so what you can see is that here's the start of the heat wave, right here. As the heat spikes, you have deaths continue to build every single day, reaching a peak here at the top of the heat wave. But the heat wave temperatures kind of cool down, and you can see that actually the deaths stay elevated even though those temperatures have fallen. And that is really due to the delayed health effects of heat waves on chronic diseases, as we'll see. So when you have environmental heat, the body it increases the body's total heat load, and the body knows what to do. There's appropriate thermoregulation. You have vasodilation, redistributing blood flow to the skin, which improves heat transfer from muscles to the skin. And then sweating, we know, evaporates and removes body heat. The problem is that sweating can lead to cooling, but also an increase in fluid and electrolyte losses, while vasodilation also leads to cooling, but it increases blood flow to the skin, which can increase cardiac demand. So in people with pre-existing conditions or heart conditions, this can lead to a mismatch, which leads to compromised cardiac oxygen delivery with chronic diseases, as we'll see. So at each stage of the spectrum of heat-related illness, there is an exacerbation of chronic diseases, which actually may not manifest in our patients for several days, like we saw in the French heat wave. So on the least severe part of the spectrum, you have heat cramps, rash, and edema due to water and salt losses. Next severe is heat syncope and heat exhaustion, and that is from decreased cerebral hypoperfusion, fluid loss, vasodilation, and that occurs less than a body temperature of 104 degrees. And then most severe is heat stroke, and this is the cardiovascular strain, and this can occur in healthy people too, due to the metabolic and thermoregulatory demands that reduces blood flow to the organs, like the kidneys. And you can also get central nervous system dysfunction and organ failure, which obviously can be fatal. Oops. Okay, and prevention and early recognition is key to prevent mortality. You can do all of these things if you know that someone is starting to feel the effects of heat. An interesting correlation is the effect of heat and mental health. We know that when heat goes up, suicides increase. The number of people experiencing major depression increases. People report poorer cognition, impaired memory. There's an increase in substance abuse. And this is borne out in epidemiologic studies of ER admissions, hospital admissions, et cetera. We know there's an increase in aggression, and this is borne out in domestic violence cases. People report irritability, sleep problems, and poor judgment. The people who are most at risk for heat and mental health, those who have dementia, even those who are on psychiatric meds. And there is a link, and it's worsened by poverty and substance abuse. Other vulnerabilities, people at the extremes of age, the young and the old, people who aren't used to our tropical climates, maybe people who winter here in Hawaii, those with chronic diseases, diabetes, cardiovascular disease, kidney, etc., people who live on an urban heat island, and then occupation, people who work outside. And then, of course, there's all the medications that we give people that interact with heat, including some of the antipsychotics and some of the mental health medications. So you may have heard of Mesoamerican nephropathy. It's also called chronic interstitial nephritis in agricultural workers. And what in 2002 in Central America, people started noticing a chronic kidney disease epidemic, where these young male sugarcane workers in their 20s and 30s were falling ill, and they had rapid progression to end-stage renal disease. And some people actually call this one of the first major diseases related to climate change. It's believed to be multifactorial, but heat stress and long hours in the sun lead to dehydration, volume depletion. There might be some confounding factors like maybe some chemical use, some NSAIDs, maybe some infectious disease exposure, all leading to chronic kidney disease. So with rising temperatures attributed to climate change in this area, there's been a lot of attention to these workers, and more importantly, some adaptation. So they have cooling stations now. This station is on wheels. It moves with them. They're obviously carrying a lot more water. So this is a very simple adaptation. Thinking about heat from a One Health perspective, about a year ago, there was a video that was circulated online that showed the fatal effects of heat stress on cattle in Kansas. In this particular couple of days, the humidity was high, the wind was low, and the cattle did not yet shed their winter coat. So all mammals, to a greater or lesser degree, are subject to similar temperature humidity limits. And unlike humans, most wildlife do not have access to AC. They can't really adapt. And these heat waves of the future could actually really devastate US livestock yields. And some of these animals had to be killed outright. So when we'll talk more about this when we get to the food system impact, but obviously the health of animals and their ability to survive and be healthy affects human health. Another example of this, just last summer in Texas, this is seen all around the world. You have these fish die-offs. They are multifactorial. Some of them are caused by algae, but in this particular beach in Texas, there were warmer than normal temperature in shallow waters. There were fewer waves to oxygenate the water. There were cloudy days, and this prevented underwater plants from photosynthesizing. Warmer water holds less oxygen, and this obviously impacted the fish, their ability to survive, and you had this very huge die-off. So you can also get these die-offs from industrial pollution and runoffs and algae blooms. And warmer water due to climate change can actually favor harmful algae in a number of ways. So you have the toxic blue-green algae that prefers warmer water. Warmer temperatures prevents water from mixing. That allows the algae to grow thicker and faster. And then this is easier for small organisms to move through and allows the algae to float to the surface. That absorbs sunlight, making the water even warmer and promoting more blooms. So it's kind of this vicious cycle. And that, of course, leads to unhealthy fish, dead fish, decaying fish, and can ultimately lead to unhealthy environment and impact human health. And we'll talk a little bit more about this later. So let's move on to severe weather health effects. It also provides a framework for some of the downstream One Health topics. So when we think about climate change causing extreme weather, you can never 100% attribute a hurricane or a cyclone 100% to climate change. The better question to ask is, are extreme events occurring more frequently? And how much more likely was this event to occur in the presence or absence of climate change? Generally speaking, for Hawaii, the extreme weather effect that we'll see will be hurricanes and storm surge. There's also drought. We'll talk about that later. And we know that with warmer water temperatures, there's more atmospheric moisture and fuel for storms that can increase the potential for tropical cyclones to bring heavier rain and higher storm surge. In Hawaii, the current thought and prediction from NOAA is that storm intensity will likely increase. So we might be subject to higher category storms, but that the storm frequency, the number of hurricanes that we see, may decrease or remain unchanged. So this was rain from a couple of years ago. It was December's Kona low. So again, a Kona low is a naturally occurring phenomenon, but the climate signature of this storm was that you had extreme precipitation, higher winds than normal, and that resulted in flash flooding in coastal areas. From an epidemiologic standpoint, what does this look like for health? In 2017, Hurricane Maria made landfall in Puerto Rico with winds of 150 miles an hour. And for many months after the hurricane, the official death toll was 64. And in Puerto Rico, every disaster-related death has to be confirmed. So a body has to be brought to San Juan, or a medical examiner has to travel to a local area to verify. So there were obviously many more deaths than 64, but how many? And I found this paper interesting because it actually illustrates the health effects of storms. It illustrates patient vulnerabilities as well as infrastructure issues. And I think for us as an island state, this is very illustrative. So the study used active surveillance months after the hurricane. So the hurricane hit in September, and they went around in January and February, and they went around to different neighborhoods or barrios based on remoteness. One of the biggest health considerations in any storm is the average time to get to a populated city center where there are health services. And this graphic just shows that they selected random barrios of differing remoteness around the island. And they went around to households and they just asked people who died since the storm, who is missing, and how did people die. And it's interesting from an epi standpoint that recall bias is not really an issue because these families knew who died. And then the missing people and families were not counted. And again, they just compared their health survey with the number of deaths from any cause 1 year prior to the storm. And this is the formula that they used. So when they went around and did this, their estimate was 4,645 deaths, 70 times more than the official count of 64 and 4 times the New York Times estimate of 1,052. And so this chart is the cause of death on the y-axis, age on the y-axis and month on the x-axis, and then you have the cause of death here. So here's the average age of death in Puerto Rico a year before in 2016. And you can see that these are unrelated to the hurricane. These are blue deaths scattered about the mean. After the hurricane, which is here, you have several different types of deaths. You have direct deaths. These are the red squares. Indirect deaths, the yellow triangle, we'll talk about that, and suicides here in purple. And then you have other deaths in gray. And what you see is that after the hurricane, first of all, there's a large variation in age. You have direct and indirect deaths that actually continue months and months after the hurricane. And this again shows that there are delayed health effects of chronic diseases and other downstream effects due to a single event. It makes sense. This chart just shows that the more remote you are, the longer your days without water, without cell phone coverage, without electricity. And this chart shows that a large percentage of households were unable to get medication, plug in and use respirator equipment, or even travel to the doctor. So this study is actually very illustrative of how devastating these high-intensity hurricanes can be to the health of an island population, days and months and even years after a hurricane. So the direct causes to death from the physical effects of the storm from the CDC include drowning, electrocution, falls, trauma, hypothermia. The indirect causes of death are things that lead the storm leads to an acute exacerbation of chronic conditions like asthma, cardiovascular disease, cleanup after the disaster, problems or injuries with evacuation. And these exposures to hazards last months after the storm. So again, there's delayed morbidity and mortality from worsening chronic conditions, usually due to issues with infrastructure, medication, etc. Other causes, disruption of services. You can't get to the hospital because of closed roads, dialysis, things like that, unsafe environments. Another indirect cause of morbidity and mortality is the psychosocial stresses and anxiety from these disorders. And we saw this with Hurricane Katrina. These citizens were being packed into the Superdome, and several studies have shown increases in anxiety, mood disorders, and PTSD among storm survivors compared to those who did not experience the storm. I learned something really interesting in refreshing my slides for you from a One Health perspective. So there's a new field called disaster microbiology, and it makes perfect sense given what we have talked about so far from a One Health perspective. So this is information from a report from the American Society of Microbiology, and they looked at various storms. So after Hurricane Katrina, there was contaminated runoff and sediment and debris and waste that harbored both human and animal fecal coliforms and enteropathogen caused by inadequately functioning water systems and overflow in septic tanks. So those injuries that we talked about previously can become entry points for pathogens, and that can cause things like flesh-eating disease. There were reports of increased cases of Vibrio vulnificus after Hurricane Ian, which hit Florida in 2022. And then you have an increase in vector-borne pathogens from standing water. So there were reports of increased West Nile after Hurricane Katrina, both in Louisiana and Mississippi. In addition, you have airborne pathogens, mold and endotoxins. So this is a petri dish with fungal colonies from an air sample obtained from a home flooded by Hurricane Katrina. And penicillium and aspergillus, they can cause allergies and respiratory infections, pneumonias, and this occurred after Katrina and Rita. And then you can also have nosocomial infections. So people in nursing homes get infections, or hospitals get infections for just by being there and being exposed to water and air filtration problems. And there was a fungal outbreak in a skilled nursing facility after Hurricane Sandy, which just illustrates how this can happen. And in addition, hurricanes bring microbes into contact with plants and animals that may not otherwise be exposed to them. So you have crop spoilage. There was a fungal blight in upstate New York after Hurricane Irene. And in 2004, for the first time in many years, a fungal infection, soybean rust, hit the South after Hurricane Ivan basically decimated soybean crops. And interesting, from a One Health perspective, again, hurricanes can actually also impact antibiotic resistance. So antimicrobial resistant germs can quickly spread through communities and the food supply and healthcare facilities through environmental contamination in the water and the soil. So that makes it harder to treat certain infections in animals and people. And in addition, more people are on antibiotics because of wound exposures. So there's an increased, there can be an increased chance of resistance. And then there are some questions that there are some theories that antibiotic resistant organisms may actually thrive at increased temperatures. And this is a report in The Lancet from 2022 that looked at just that. So they looked at the prevalence of 3 bacteria that are behind antibiotic-resistant hospital infections. So Acinetobacter, Klebsiella, and Pseudomonas. And they looked for links between temperature and antibiotic resistance by comparing the bacterial data from people treated in hospitals across China with information about average air temperatures in the cities across in the same regions. And they corrected for things that could affect drug resistance, like the levels of antibiotic consumption, yearly rainfall, population density, et cetera. And after correcting for all those, they actually found increases in the percentage of resistant Klebsiella and Pseudomonas with an increase in temperature, but not Acinetobacter. And the authors actually hypothesized that maybe increasing temperatures can increase the growth rate of bacteria, speed up their evolution, and therefore development of resistance. And there's actually also some evidence that bacteria can share resistant genes, and that's more easily shared in warm conditions compared to cold ones. And they also hypothesized that the high temperatures might induce genetic changes in bacteria, which can help them to resist antibiotics. So we can really see how climate change can influence so many aspects of our interconnected health. Expanding on what we just talked about related to storms and flooding are the impacts of climate change on water quality, which is very much related to One Health. So in general, as we alluded to, when you increase temperature, that means an increase in pathogen survival and pathogen reduction. And that's mainly through you also have the effect of precipitation and temperature changes on fresh water and also marine water quality and quantity through urban, rural, and agricultural runoff from storms. And the runoff, in turn, can affect human exposure to water-related illnesses, primarily through contamination from pathogens. So waterborne infections include viruses, bacteria, and parasites, and that's through ingestion, inhalation, or direct contact. When we think about Hawaii, what might we expect with climate change? And pathogens in Hawaii in 2011, and they found that out of the 22 streams that they surveyed, all 5 had the pathogens Salmonella, Campylobacter, Staph, Vibrio, and Parahemolyticus. And this is a picture of the aloi. The aloi is actually well known to contain Vibrio vulnificus, especially at the stagnant end of the canal, and that's the one that can cause wound contamination, flesh-eating diseases, and sepsis. So with climate change, we actually may see an increase in these bacterial illnesses with flooding and storms, especially since we know that these bacteria are actually lurking and present already. As streams overflow and people come into contact with contaminated water, we may actually see an increase in lepto, salmonella, and giardia, and also rat lungworm. All of these thrive with higher temperatures and higher rainfall. As for some other pathogens, we don't really know or think maybe there will be little change with infections like Ciguatera. It's already endemic. Cryptosporidium or gastroenteritis, we just don't really have enough evidence. Maybe some of the microbiologists on Zoom can correct me if I'm wrong. One quick point about another waterborne disease is Vibrio cholera. We are actually in our 7th cholera pandemic since 1960. It sickens about 3 million people a year, and it kills 100,000 people a year, mostly in Africa. So remember that cholera occurs in areas of extreme poverty with untreated water, and you need a very high inoculating dose for outbreaks. Climate change can cause patterns of rain that favor cholera. Cholera also interacts with migration, conflict, and poor access to health services. In general, cholera is a lack of adequate water and sanitation. So Hawaii is likely not to be affected by large outbreaks. There were several cases in the 90s of imported cholera, but these were contained and didn't spread with sanitation and access to healthcare. Shifting gears and related to extreme weather in our neighborhood is sea level rise and environmental degradation. That can cause things like forced migration, loss of cultural ties to the land, and these things actually directly impact health, as we'll see, and is of course connected to One Health. So in our Pacific neighborhood, the Pacific Islands contribute less than 1/10 of the world's total greenhouse gases. However, we know that these low-lying atolls at sea level are a region that have already and will suffer some of the most devastating consequences of sea level rise. So this is the Marshall Islands, and you can see this is a graveyard that is being eroded by sea level rise. And in 2019, the Marshall Islands declared a national climate crisis, and they were trying to decide whether to relocate their nation to certain islands, whether they should abandon certain villages, or even build new cities in higher areas. And climate migration is actually already occurring. This is a Micronesian family in a shelter in Kalihi, and their family was profiled in a homelessness and climate change article in the Huffington Post a few years ago. So people are actually already here. From a One Health perspective in our global neighborhood, environmental degradation destroys the health of our reef. Polyps are animals, and reefs, as you all know, are some of the most delicate underwater ecosystems. So stressors like overfishing, pollution, and climate change have all been shown to increase instances of disease and large-scale coral die-offs. And coral bleaching is by far the most visible sign that the balance is tipping. And that's triggered by heat stress. And when this happens, the corals whiten. So how does this affect human health? The reefs are often called the medicine cabinet of the sea. 90% of the available drugs with a marine origin come from reefs. And for example, coral lives in shallow, sunlit environments, and they need to protect themselves against the sun, especially during frequent exposure at low tide. And so coral actually has a symbiotic algae that produces an active substance called mycosporine-like amino acid, and that's now actually was discovered and patented as a UV filter. So there's a lot we don't know yet, but there's incredible natural ingenuity from our reefs. The coral reefs actually provide a barrier to storms. They can reduce free-floating pathogens. They can water purify. the area around the reef, and they can even transform wastewater. And then the One Health connection, which I find so interesting, is when you lose the reef, you lose food source and cultural traditions, and you start to increase importing of nutrient poor food. And this connection is actually very real. So the destruction of the coral reef leads to a loss of cultural practices like fishing off the reef, and that leads to less fish in general, which leads to eating more canned and processed foods, importing things like salted fatty foods, and those things can lead to obesity, diabetes, and cardiovascular disease. So for example, the first dialysis center was opened in Fiji in 2008. And despite the cost of running dialysis on Fiji, the demand for treatment increased so much that in 2022, there are now 6 standalone dialysis centers in Fiji today. And in 2010, the US affiliated Pacific Islands actually declared a state of emergency due to non-communicable chronic diseases like diabetes and heart disease. So I think it's so interesting. That's such a good example of the human environmental animal connection from One Health. Okay, let's switch gears and talk about vector-borne diseases. So things like malaria, dengue, chikungunya. This is very One Health. So the two, again, to focus on Hawaii, mosquito-borne diseases are most relevant in the tropics. And there are 2 big carriers of diseases, the Aedes aegypti and Aedes albopicus species, and then the Anopheles mosquitoes. Anopheles are not present in Hawaii, but they're the mosquitoes that cause malaria after being infected with a Plasmodium parasite. Just to point out that malaria occurs disproportionately in Africa. It sickens millions, hundreds of thousands of deaths. Most of the people who die are kids under the age of 5, and it's a huge global health issue. Those mosquitoes are present in open water like these rice paddies. Again, they're not present in Hawaii. The Aedes mosquitoes are here, and these are the mosquitoes that have the potential to transmit dengue, yellow fever, chikungunya, and Zika. And those are different types of viruses. Aedes aegypti is the most efficient carrier of all these diseases, but it lives only on the Big Island. Aedes albopicus lives on all islands, and these mosquitoes love breeding in containers of standing water. So dengue, chikungunya, and Zika have similar symptomatologies, and those include rashes. This is the rash in dengue, high fever, muscle pain, eye pain. I don't know if anyone has seen dengue, but the pain from dengue is so bad, it's called bone break fever. And just to remind you, Zika has a similar symptomatology, but it is the one that is associated with microcephaly in babies whose mothers are pregnant with Zika, so it can be very devastating. So these vector-borne diseases are not endemic in Hawaii, but they are endemic in our global neighborhood. So they're endemic in Samoa, French Polynesia, Micronesia, etc. So in Hawaii, what we're more likely to see is travel or imported cases of an outbreak, which is then contained. And this actually happened on the Big Island with dengue fever a couple of years ago. So what do I mean by travel or imported? So someone already contracted dengue in our Pacific neighborhood. Say they went to Samoa, got bit by a mosquito, contracted dengue, and were sick with it. Got on a plane, came home to the Big Island. A local Aedes aegypti mosquito then feasted on this person. Human to mosquito transmission occurred. Those mosquitoes that bit this infected person got infected and then bit several hundred people in the area. So there were 261 cases reported. This is from the DOH between 2015 and 2016. This outbreak was contained via spraying, standing water management, public health education, and mosquito control measures. So this is just the DOH's vector control branch. Here's the outbreak in 2015 and 2016. And you can see that we have several reported cases of these viruses, but they're fairly low and they were travel related. With climate change, we see again the same story. With increasing temperature and increased rain, this favors survival of the larva, via a faster life cycle. And then we also have, with warming temperatures, mosquitoes can now live in places they previously could not. And this is a study in The Lancet predicting the effect of climate change on the distribution of dengue. So the more red means more of the population is at risk for dengue. And you can see that by comparing in 1990 in panel A and 2085 in panel B, we are more likely to see more people coming into contact with these diseases. Again, in Hawaii, they're probably not likely to become endemic because dengue actually does not have an animal reservoir. In contrast, there are other viruses like West Nile that can be carried by birds. And so mosquitoes can spread the disease to birds, and they can have this reservoir where they hang out and then continually infect the population. For us in general, in Hawaii, we don't have this animal reservoir. I will qualify this. I learned that there is some possibilities that monkeys in Africa and Southeast Asia may actually be a dengue reservoir, and someone can correct me if I'm wrong. But for us in general, we'll probably see more travel-related outbreaks, which we have the ability to contain. And again, Aedes aegypti is the most efficient vector. It only flies a few hundred meters from its hatch site. So really the mosquito is not expected to fly inter-island, but there's always the possibility that larvae could catch a ride on human goods inter-island, or that the disease can affect humans traveling in our Pacific neighborhood. But again, small outbreaks. When we talk about climate drivers and non-climate drivers, both of these things can actually change the distribution of things like malaria. And so I'll explain what I mean in a second. But this study looked at a time series of microscopically confirmed Plasmodium falciparum cases, those are in red, and Plasmodium vivax cases, these are different types of malaria, and those are in blue, in Ethiopia. And what you have here is an elevation map, and it shows the highlands of Ethiopia. This is what they look like, and it's overlaid with cases where malaria actually expanded between 1981 and 2014. So what you had was malaria cases were actually traveling up the mountain to higher elevations where it was not seen prior to 1981 because of a climate driver, that is a warmer environment. They were able to live at higher elevations. The non-climate driver here was that it coincided with more people moving to these higher elevations. So you have this interesting interaction between people and the environment and climate change causing more disease. We do not have ticks in Hawaii, but our patients travel to the mainland all the time. I'm from Connecticut, which is tick central. Just to review, ticks are born in the summer. They have their first feed on small rodents and squirrels who are infected with the Borrelia bacteria or the Rickettsia bacteria. There are actually a number of different tick-borne diseases. The ticks become infected, and they go on to bite and infect humans. All of these diseases in general can cause rashes, fever, terrible joint pains, neurologic cardiac complications, and they're quite terrible. And again, we see the same story. Climate drivers like increasing temperature means that more ticks can survive. They reproduce faster, they die less, and they can survive actually in more northern latitudes. The interaction with humans is that in some of these cases, you can see that Lyme disease cases have increased further north. Some of these communities, people may not recognize them because they've never had them before. So the disease now has a larger, more northern geographical reach. The other non-climate driver is that humans are moving into areas where they previously didn't live. So more people are coming into contact with ticks and deer and rodents and animals and are at increased risk. Going on to food system impacts, we know that climate change is impacting our water and food and all of our supply. And this can lead to malnutrition, food insecurity, higher food prices, foodborne illnesses. And this is actually a huge topic. This can be impacted from drought and flooding. This obviously impacts food systems and animals and plants. We're talking about also the quality and quantity of our fish catches, which decline with warmer water and warmer weather. This impacts contaminated food, failing crops, and even political instability. So food prices were seen as a contributing factor to the Arab Spring uprising in 2011. So with climate change and food security, adaptation will be key, not only in what we plant, what we plan to do with the mix of livestock and crop production in our land, and also how much and what we take out of the ocean. And we've seen in general how a warmer world increases the ability of microorganisms to survive and thrive. And of course, that impacts One Health through animal health and welfare. So poorly cared for animals are more likely to develop diseases. It's interesting to think about how you might care for an animal in a heat wave, or what if a storm brings contaminated water to the farm or a ranch. And we know that pathogens have the potential to spread at every stage of the animal food handling process, from breeding, processing, packaging, storage, transportation, and marketing and consumption. And as we saw, these pathogens spread as we have warmer conditions. And then the other interesting contributor is we also have the use of antibiotics in animals, which contributes to antimicrobial resistance. And the things that we have to be concerned about are bacteria, viruses, parasites, and fungi. So for example, Hep A, you'll hear in the news, pops up from time to time in agricultural batches. Aflatoxins are a family of toxins produced by certain fungi that are found in crops such as corn and peanuts and tree nuts. And they can produce aspergillus and Aspergillus parasiticus, and those become abundant in warm, humid regions of the world. You also have things to worry about like telenium, which causes cysticercosis, which is a parasitic disease, pork tapeworm, and it frequently infects the central nervous system and is actually a major health problem in developing countries in Asia and Latin America. So all of these things interact in a One Health perspective. The last thing we'll talk about are the health effects due to air pollution and allergens. Again, climate change is unequal in its impact, and air pollution in developing countries is actually alarmingly high. So this is not COVID masking, this is air pollution in India in 2015, where there have been millions of deaths due to the joint effects of air pollution and indoor air pollution. So indoor cook stove pollution kills 2 million people a year, mostly children. Wildfires contribute particulate matter, which cause chronic health effects. And this is also a huge topic. And it's especially among those, worse among those with chronic heart and lung diseases. So asthma, COPD, cardiovascular disease, and wildfire pollution, regular air pollution can actually cause premature death. Climate change has also lengthened the pollen season in North America due to increased CO2 causing a growth of weeds and grasses, and that can exacerbate respiratory problems. In Hawaii, we also have the risk of mold that comes with heavy rainfall and flooding, and that can cause dampness, indoor mold, and fungal growth, and that's associated with nasal and throat symptoms, coughing, wheezing, asthma exacerbations, and other problems. And this is flooding and mold damage at the UH Library, Hamilton Library in 2004. And you basically only have 3 days to clean up before that toxic mold sets in. So I know we've gone through all of this very, very quickly. To give an overview and a general perspective of the wide range of health effects, both direct and indirect, on physical health and mental health, and a worsening of chronic diseases due to climate change. So how are we not all plunging into eco-grief or eco-anxiety, which is a real DSM diagnosis now? And for me, it's actually the knowledge that climate change is solvable, and that as a physician, as physicians and healthcare workers, we can actually leverage our profession to make changes. So we can weave climate change and health throughout our medical school curriculum. And we're actually seeing challenges being overcome in all areas of the world. So this is the world's largest solar-powered teaching hospital, and it's in Haiti, which is the poorest country in the Western Hemisphere, and it was built by Partners in Health. And I found that really remarkable things are happening all around the world. So in Eastern India, there's a 13-hospital eye care system that has gone completely green. They have gardens and solar power, transportation, and most impressive, they've reduced their surgical waste through a thoughtful recycling and sterilization of materials. So this is waste to the left of 1 cataract surgery in the United States, and on the right is the waste from 93 surgeries in India without an increase in post-surgical complications and infections. So very impressive what people are doing around the world. And it's not only new technology that will get us out of this mess. We, for so long, not thought about, ignored indigenous practices that took care of the land and the people for centuries. And again, from a One Health perspective, this integration of land and animal and human interaction and health has been practiced and ingrained and is not separate for centuries. So really listening and learning from this wisdom, I think, should be a top priority. So to end, climate change is solvable, and that's what gives me hope. We don't have enough good news, but the good news is definitely out there. We have an Office of Climate Change and Resiliency here in our state, but bills and things in legislature need testimony, and testimony, I think, from the healthcare community is very powerful. So we have a lot of agency. You don't have to go and march, but you can also work behind the scenes and make your important voice heard as a trusted messenger. And I love this cartoon at the end showing the co-benefits of combating climate change, green jobs, sustainability, livable cities, healthy kids. And this guy in the audience says, what if it's a big hoax and we create a better world for nothing? So that is it. I will stop sharing my screen and can take questions if there are any. Oh, there are some. Someone said they had dengue, exactly as described. Yes, it is terrible. Should I just read this question here?
Sure.
Okay,
I can read
sure.
it for
Thank
you
you.
if you don't mind.
Thank you. Sure.
Yes, so Varney says, thanks for the beautiful presentation. Climate change is sometimes linked to human activities such as deforestation, sand mining, carbon monoxide, etc. What are Hawaiians doing that is leading to climate change and how can they be mitigated? And then the second question is, the adaptation of the Anopheles mosquito requires a favorable temperature. Do you project the introduction of malaria in Hawaii if the temperature in Hawaii keeps changing?
Good questions. I'll talk about the second question first, and maybe someone, I know there are some experts in the audience too who can jump in. But as far as I understand, we don't have anopheles here in Hawaii. I don't know if it were introduced by accident, if it were to come over on a crop, if it would be able to take hold. But in general, we know that increasing temperatures favor the life cycle of these organisms. I don't actually know specifically. If anyone knows in the audience, please jump in, whether anopheles could take a foothold here. Hi, Dr. Chang.
Yeah, hi. Actually, we have Dr. Kenton Kramer, who's also in the audience, and he has followed the monitoring of mosquitoes in Hawaii for a while. Kenton, you want to say a few words about, what has happened historically? I know you're very familiar.
Thank you.
When I was growing up, we lived in Kailua, next to the Kaiwanui Marsh, and there was a 80s albopictus eradication program going on, and the fog trucks used to come in uh, 4 times a year or so and just fog the whole neighborhood. um, I guess it reduced the mosquito population somewhat. And that was probably historical from World War II when we did have dengue outbreaks with troops coming and going. There's been a few reported incidences of anopheles, but I'm not sure. I don't think any established colonies have been found. But yes, both species of Aedes are found on the Big Island.
Thanks, Kenton.
Thank you. And then to answer the first question specifically about what is being done about climate change from a Native Hawaiian health perspective, I can tell you from a physician and healthcare perspective, I will invite everyone on the call to join. The Department of Health has started a climate change and health working group. So anyone with an interest in health and climate change can join. And we have several people who are involved in Native Hawaiian health as well, who have joined us. And it's a new group, and we meet once a month, and we are just forming and working together to come up with actionable items that we can do to combat climate change, specifically through a health lens. So one of the first things we're going to be doing is we've written an op-ed that will go out very soon, talking about the health effects of the Maui wildfires and our kind of wish list for health following disasters and what we can do about future disasters. So I can put a link in the chat to our group if anyone would like to join. Let me just find that link. If there's any other questions.
Hello.
Yes.
Yeah, so I'm much more concerned about what are the activities, what are the human activities that lead into climate change. So because if we know the activities, for example, if you have a lot of old cars in Hawaii that is putting out carbon monoxide in the air, that will create a problem. For Africa, there are a lot of people that were mining sand at the beach. So those sand mining led to a lot of flooding, erosion and others activities. So some countries now trying to do reforestation. So was there the deforestation in Hawaii? So, these are activities of human, like these are deforestations that gradually will lead to warmer temperature. So what were the activities of the Hawaiian that? Because I came here in 2020 and then the weather was there was a lot of rain at this time and it was more cooler. So I'm experiencing more heat as compared to 2020 when I was here. So that means that there's a change. I mean, everyone is like experiencing change. Is it due to high population? Is it that the Hawaiian populations have increased from 2020 to now? I mean, what are some of the factors, that actually leading to this?
Yes, that's a very good question. We know that in general, Hawaii has gotten hotter. So it's not in your imagination. It's definitely the experience of people. And we have data from NOAA, the National Oceanic Atmospheric Agency, that it is hotter here. To answer your question about the shift in population and the number of people, I don't know that. I don't know if anyone in the audience knows that. But we do have an Office of Climate Change and Resiliency, and they are focused on doing those mitigation strategies that you talked about. So preventing reforestation, actually planting trees. There's a professor at the University of Hawaii who has a 1,000,000 tree campaign and is trying to plant more trees to mitigate the effects of CO2. So those things are happening for sure in Hawaii. And the Department of Health also, from our perspective, from a health perspective, we want to talk about mitigation, but we also want to focus on adaptation and the things that we can do from a health perspective to protect people while all of that other stuff is going on in the background, to reduce the number of cars on the road, to increase the number of trees, things like that. We're approaching it from a health perspective. But yes, things are definitely happening.
And it's driven not just by local effects. I mean, it's a global
Correct.
warming trend. So
Yeah.
part of the change that you're observing is a global change. Yeah. Oh, there's one more question about the Lahaina. Oh, mental health. Yeah.
Yes, mental health. And we, so there's another physician in our group who's a psychiatrist, Dr. Jacob Lee, who I think might be the only one in the island who actually advertises that his specific interest is the mental health effects of climate change on young people, which is a DSM diagnosis now. So more younger people, and this has been shown in studies throughout throughout the US, throughout the world, are experiencing depression, specifically hopelessness related to our environment and eco-grief. And James, yes, thank you, James. Just posted our emails. If anyone is interested in joining the Climate Change and Health Working Group, please email us. We are happy to have everyone's area of expertise, and we've got some different subgroups so people can really work on doing things that make a difference soon, rather than just give talks or write op-eds. We really want to focus on doing things. So we welcome everyone.